Good evening, everybody. Akash Shinti, your favorite biotech research analyst, here with a video today on, drumroll please. I forgot what the video is on. I'm just kidding around. No, in all seriousness, the video today is on pharmacies. We're going to talk a little bit about pharmacies and how they relate to the biotech pharmaceutical industry, why they're important, first off, in the grand context of healthcare, what do pharmacies do, and what is the connection between pharmacies and biotech. Awesome. With that, so if we zoom out on our lens right now, imagine you're looking through a camera, a beautiful camera, and you have a huge landscape right in front of you. The landscape is, in the foreground, you've got a lake, and in the background, you've got mountains, snow-capped mountains, fir trees kind of encasing the lake and surrounding it. And as we think through this experience and just imagine this being in this place while taking in a few nice deep breaths, we think of the healthcare landscape. And first off, you're like, what does that have anything to do with the healthcare landscape? Well, there's a lot of things ongoing in that scene that we just painted together, as much as there are in the healthcare landscape. A lot of things that may seem visible are simply invisible, and the things that may seem invisible are actually very visible. What am I trying to say here? Well, I'm trying to say that healthcare is both very simple, yet simultaneously complex. And there's many issues, as many of you probably are aware, within the industry right now, particularly with regards to drug pricing and things of this nature. Part of what I'm aiming to do and seek to do through these videos, along with helping educate others, is to address some of these issues. And so, getting back to the earlier topic of pharmacies, I wanted to paint this picture because I wanted to illustrate to you that healthcare is a really large field. There's so many different players and stakeholder groups that are responsible for different pieces of the healthcare landscape. Similarly, as there are many different pieces to that landscape, as we provided the picture earlier. Each piece is critical for the sustainability and the livelihood of all of the other pieces. Now, pharmacies so that's the why. Why are pharmacies important? They're critical components to the larger healthcare landscape. And in a future video, we'll go through what are each of these different pieces in detail, and maybe we'll talk about the incentives behind each of these, both from a financial perspective, as well as a cost or benefit to society perspective. So with that, pharmacies are the place where, as I'm sure many of you know, is the place where you get drugs. No, I'm not talking about your local drug dealer on the street. Good one. No, in all seriousness though, it's a place where a patient will go and fill their script. So you go to a doctor's office, doctor prescribes you a drug to treat a specific condition. As you take this, then you go to so after the doctor's office, you take this script, and you go to the pharmacy's office, and they will fill your script. In other words, they will give you the drug that the doctor prescribed you in the correct dosage, and give you some information about the drug itself and what you're taking. Now, it's really important to note that pharmacies serve many different purposes, one being a distribution center for drugs from a wholesaler or a larger repository or manufacturer to a smaller place where delivery of these drugs and this healthcare is dispersed in manners that are digestible. In other words, what I'm trying to say is drug companies make thousands of drugs. You don't go to a drug company and be like, hey, I need some aspirin or something like that. There's a whole network that surrounds it, and you would end up going to your pharmacy. Similarly, the idea, so one is that they're kind of a store for drugs. Second is that they provide a critical role in the sense of connecting the patient to the drug itself in terms of understanding. So they provide a lot of information around the drug itself in ways that doctors are simply not trained in. And so pharmacists play a really critical role in the sense of educating patients, particularly as to what may a drug do to a patient. So these are a couple of things that pharmacies play a key role in. it's important to note that there's different types of pharmacies, actually. So there's your retail pharmacy, which is like your CVS, your Walgreens, kind of down the street. You also have a mail-order pharmacy. These are typically for specialty drugs, and we haven't covered specialty drugs yet, but we will in a future video. Specialty drugs, in a nutshell, are drugs that are not, it's not something that most people are getting. In other words, examples of these might be cancer drugs. It might be drugs for rheumatoid arthritis. So some kind of, typically rare diseases or diseases where it's not as common, but the effects of the disease are highly debilitating, or they really have an impact on the person's quality of life. So that's a mail-order pharmacy. Typically, the pharmacy will ship in the drugs, particularly to the patient's house, and they'll give a script either online, via phone, or in the mail. And lastly, the last type of pharmacy is the hospital pharmacy. So this is the pharmacy for the hospital itself. As you know, hospitals oftentimes will administer drugs to patients, either during surgery, during procedures that they're doing within the hospital itself, or simply just to have on hand for any patients that may come through the hospital that may need particular drugs. So the last pharmacy is a hospital pharmacy. And you don't really see this. You don't see hospital pharmacies, and you don't really see all too many mail-order pharmacies, or at least most people don't. So that's a little bit about that. Now again, what's the relationship between a drug manufacturer and a pharmacy? Well, I'm glad you asked that question, first off, because it shows me that you're thinking and you're asking the right questions. In all seriousness, though, there's a key relationship between the manufacturer and the pharmacy. At a high level, manufacturer ends up distributing their drugs through these pharmacy channels. So one way to think about it would be a distribution network. Another way to think about what pharmacies and drug companies, the way they interact and work well together, is that when a drug manufacturer sells drugs to a pharmacy, in exchange they'll get data from the pharmacy about how many drugs were filled, how many prescriptions were filled, prescriptions being like little scripts, and how many patients are really seeking to take their drug. This information is critical for developing a sales force and coming up with strategies. So these are another thing in terms of the way that pharmacies and manufacturers have been doing to work together. Lastly, pharmacies also provide a very small sense of healthcare to a community. So oftentimes, I'm sure you guys are well aware, you go to your retail pharmacy and you can get a flu shot, or you can get some type of just very basic first aid treatment or some such thing. CVS, I know, has been doing a great job of this recently. Diabetes education, and so on and so forth. So pharmacies are increasingly so being seen as another place where healthcare can, a place, not only a place of sale, but also a place of where one can receive treatment or healthcare in and of itself. So they play a key role, and to that degree, they enable a connection point between the pharmaceutical manufacturer and the patient, in the sense of they provide a lot of education and they give a lot of insight or a valuable patient education on particularly the diseases that they may have, and some drugs that may combat the effects of this disease. So with that, we kind of covered pharmacies at a high level. There's much more we can get into. I hope you guys enjoyed this video. Like, subscribe, comment, share if you guys think this is interesting and valuable. Sometimes you just got to do a dramatic pause. Anyways, in all seriousness, really hope you guys liked this. Share, comments. Let me know any questions you guys have, and I will see you guys in the future. Keep up, thrive, always stay safe.